feeling of sadness is, usually we associate that with more like a very temporary thing. If a loved one dies, like it's not unexpected that you would be sad about that. Depression is more kind of, you can feel sad, but it lasts for a long, long time. Even if your life is great, you can still have depression and feel sad. It is kind of difficult to tease out sometimes if there truly is depression present or if it is just kind of normal sadness. They are very different. I like to think of depression as a disease, and it kind of has a spectrum where the very best spectrum is you're feeling good and you're on medicines and that are helping you. The very worst spectrum is that you're having thoughts of suicide or even sometimes homicide where you want to harm somebody else, and that is a medical emergency. I tell patients all the time that it's a perfectly acceptable reason to call 911 if you are feeling like you want to harm yourself, and especially if you have a plan. So even if you don't feel comfortable reaching out to a family or a friend, calling 911 is, again, it's a perfectly acceptable reason to get emergency medical treatment. Fortunately, depression and anxiety is getting a little less stigmatized, but it still is there, I feel like. Even when patients get checked in now, we have a quick little questionnaire that we ask them, 2 questions about, are you feeling depressed, are you feeling hopeless, and things. And so that's kind of a piece of it, but people can, manifest with emotional symptoms as far as feeling sad or feeling hopeless, but it can also be physical symptoms, and that kind of plays in a lot into depression and anxiety as well, as far as like, sleeping more or less, appetite changes, feeling, like you just can't do anything, or feeling really agitated. So it's kind of all a spectrum of the physical and emotional kind of components that we use as providers to kind of say, yes, you would meet the criteria for, depression or anxiety, and kind of base our treatment on those symptoms. So keeping track of kind of your symptoms that you're having that just don't seem right to you or that are bothering you would be helpful to present to your primary care, because in primary care we can do a lot of management of emotional concerns. A lot of times if I am taking care of someone and they meet the criteria for depression or anxiety, I often encourage them to start on a medicine. Depression and anxiety are diseases. We have medicines to treat them and help you to feel better. Frequent follow-up is another thing that I feel very strongly about. I want to see you back to make sure that you are starting to feel better. And if not, what other interventions can we take? Emotional well-being is something that can really affect people's lives with their families and their work and just their personal life. And so it's something that I feel very strongly about, that if we can get you feeling better, how, and again, following you closely to make sure that that's happening.